Thank you very much. Good afternoon, everybody. Bonjour tout le monde. My name is Marcel Acco. I'm the Executive Director of the Canadian Agricultural Safety Association, and I want to welcome you to the second of our 4 virtual sessions, which is Bridging Over Troubled Waters. So we've invited quite a few people to talk about the innovations that have happened in agriculture with the pandemic on the horizon, and I guess going on for quite a while. And I want to make sure I recognize our sponsors, which is TC Energy, and also the Canadian Agricultural Partnership of Agriculture and Agri-Food, and Safe Work Manitoba has also helped sponsor this. So just a couple of housekeeping details. We do have simultaneous translation, and you should see a little globe on your screen, and you should have English to French translation. So si vous cherchez pour la traduction de anglais à français, il devrait avoir un petit un globe, on va dire au fond là, proche de votre nom, et puis vous avez accès à la traduction. So appuyez sur ce piton-là. Just for Christine's sake and for the chat and everything, if you could modify your actual name if it's not clear. Sometimes we get phone numbers and just numbers. It's nice for other people to know who's also participating. So I think you can do that by going to your name, and on the 3 dots, you can rename yourself. We'll be using the chat function to record your questions. So use that chat function, and then afterwards we'll pull them and bring them to the group. If you have questions in French, just write them in French. I'm bilingual, and I'll pull them out and bring them forward to the presenters. As you've noticed, everybody's automatically muted, and the video is off except for the presenters. And the session is being recorded. So we just finished recording, putting up the recording from the last session. So what we're doing is we're recording the session. Not quite sure how the breakout rooms are going to work, but the main session will be recorded. And our Jessica, who's working with us, will be taking notes and providing a summary. So after this session is finished in about a week or so, you should have a summary document that will have links to any of the resources that people will have posted, and a link to the actual webinar or the recording of this if you want to see it. So I think that was it for my opening things. So we are a safety organization, so thought I should have a safety tip. So I asked Rob to give us a tip, and wouldn't you know, it's a COVID-related tip, and not any surprise to anyone, but I guess wear a mask in all indoor public spaces, and even I guess when you're close to coworkers, stay home when you're sick. There are quite a few self-assessment tools available online to help you determine what your sickness level is. Practice social distancing, hand washing, sanitizing, and cough etiquette. And follow the guidance, public health guidance on travel and self-isolation. And if you're vulnerable, such as my age, a senior, you're encouraged to exercise additional caution and work from home if you're able to, and don't mix households if you don't have to. So that's the part that sucks, is our personal sacrifices that we have to do to help stop the spread of this. And interesting enough, next week, if you log into our session, we'll be talking about mental health and how to, the new resources out there for farmers and how we can support them better. So this year has been a year of transition, and we've wanted to continue to do resources And we're going to use the breakout room function. Good news, bad news is we're able to do breakout rooms. And then when we were testing it, we found out if you don't have the latest version of Zoom, you can't choose which session you're going to go in. So we made a decision to just assign or ask Zoom to assign everybody randomly. And again, if you're not in the room you wanted, I'm sure it'll still be interesting. And a summary of the discussions will come out. And then we'll have the speakers. So we have Lori and Dean and Wendy all speaking in those sessions. So just to give you a bit of how we're proposing this works is we're going to be starting shortly, and we'll give the speakers till about 1:50 to give out their presentations. And then we're going to assign everybody to these breakout groups, and that'll happen for about 20 minutes. And then you'll see a pop-up that says your breakout room is going to close in whatever, 50 seconds or something. And then you'll all be dumped back into this main, this main session. So the chats we'll be monitoring. So if you have questions while Carolyn or Rob or Peter are speaking, just put them in the chat. And if we have time, we'll deal with them, but at the, while the presenters are presenting, but if not, we'll just bring them back at the end. We've assigned 20 minutes just for questions. So yeah, so just a reminder, the 3 breakout rooms, each covering a different topic, is temporary foreign workers and labor shortages. So Wendy Bennett, the executive director from AgSafeBC, will be working with that one. Dean Anderson is going to be talking about some of the changes that's happened with the greenhouses and the U-picks. And Lori Brookhouse from Farm Safety Nova Scotia will be talking about the whole thing about the PPE supply and resources. And probably Carolyn will probably touch on that a little bit also. So I think that's kind of all I had to say right now. So now I can move on to Rob. So first of all, I'd like to introduce Robert Gobeil. So Rob is our agricultural health and safety specialist, and he grew up in rural Manitoba. It says here he spent many informative hours on his grandparents' grain and poultry farm. That's probably called chores at home when I was growing up. So, and he was a supervisor in the heavy construction sector. So Rob currently manages the Be Grain Safe program and course developments and other projects for CASA. And he leads a group that he's going to be talking about, the Safety Leadership Panel, and helps us out with the Technical Committee for Agricultural Machinery Standards and with the Safety Days, some of the content. Rob, his wife Brianne, and his youngest daughter, maybe he'll even put up a picture of her, Ilian, live in Winnipeg, and Rob also has a son, Sean. So Rob will walk us through the resources pooled by the CASA-led COVID group. And so, Rob, I'll ask you to take it away.
Thanks, Marcel. Okay, just give me a second here, folks. I just need to get my screen shared with everybody. Okay. And flipperoo. Okay, we should be good to go. Marcel, we're good. Can you confirm?
Yes.
Okay, thank you. Okay, so thanks everybody. So today I just wanted to give a high-level overview of our COVID-19 discussion panel that we created. So who, when, and why? So as the global COVID-19 pandemic hit, CASA identified a need to share quality, accurate, ag-specific resources and information with our partners and stakeholders across Canada. So with that being said, CASA reached out to our provincial partners across Canada, and we formed this discussion panel. Our first meeting was held on April 16th using the Zoom platform. So some of CASA's provincial partners consist of provincial agricultural safety associations, such as AgSafeBC or Farm Safety Nova Scotia, for example, and other invested groups such as Ontario Federation of Agriculture, or OFA. Our meeting format, we started off with our first handful of meetings were held from weekly meetings, were held from April 16th to May 28th. And then as things progressed, we changed it to bi-weekly meetings between June 11th and June 25th. The reason for this was initially we had anticipated that the pandemic would not last very long, kind of everybody's thought at the time when it first hit. And more meetings were arranged as the pandemic set in. And the frequency has been adjusted just to suit our own work schedules. So we're still having ongoing monthly meetings, and meetings average about 1 hour in length. Also, we prepare an agenda that is distributed to our partners, ideally a week beforehand, but usually a minimum of a few days before each meeting, as well as we do a follow-up set of minutes that's distributed for each meeting as well. So meeting content. Early on, meetings focused on sharing relevant information and resources to share with members and stakeholders. An evolving resource document was created that outlines resources available in each province, as well as with partner organizations. This document is posted on the CASA website under the COVID-19 resource page, and I'll touch on that shortly as well. Again, meeting content. Eventually, the discussion shifted to discussing specific challenges that arose as things progressed with the pandemic. Partners discussed, created, and shared resources and tools to help alleviate some of these challenges. And some examples of these resources, again, will be discussed in our breakout sessions. So just a couple of quick visuals here of some of the challenges we had with personal protective equipment, temporary foreign workers, and mental health issues are examples of some of these challenges. Yeah, last but not least, of course, the mental health. As COVID, as the pandemic progressed and set in for the duration it has so far, we realized eventually that mental health concerns were starting to be an issue. So we've done our best to share all of that information with our outreach and our partners' outreach as well. Also related but not part of the group activity was the realization that many kids were at home because of schooling at home and things like that. So we worked with the Progressive Ag Foundation and BASF to create a kids page on the CASA website with safety resources for youth. So meeting outcomes. So one of our big goals was to create ag-specific resources and distribute them, like I said, to CASA's outreach, to our provincial partners' outreach. The way CASA works is our membership mostly deals with other safety professionals in the industry, so we don't necessarily filter right down to the producer. So that's why we work with our provincial partners and other stakeholders, because they have that direct contact with the producers out across Canada. So some of the results were heightened COVID awareness across the ag sector, more efficient and cost-effective strategies to share information versus each province dealing with this individually. So that also translates to less duplication of resources. It's far more efficient for us to have these meetings than have two separate provinces or several provinces working on the same type of resource. So it's a lot more cost effective and quicker for everybody to build these resources and just share them. Also, one added bonus was it really built and solidified some great partnerships with our provincial partners and stakeholders. So this is just a quick snapshot of our CASA's COVID-19 page. We're super proud to have created this page, this microsite within our website. The resource list was created in collaboration with the resources shared by our provincial partners. Most of the partners have also created their own COVID-19 pages and have shared these resources and links with their membership and stakeholders as well. So where are we now? The Provincial Partner COVID Discussion Panel has recently renamed to the Provincial Partner Leadership Panel. We're still conducting ongoing monthly meetings, and I think that's going to be a thing well after COVID as well. Like I said, we've cemented some really great partnerships, and we just want to continue that discussion. So discussion items also include the COVID-19 topics, but we've expanded our group to include non-pandemic discussion and sharing of resources and information. And one of the great benefits of this is now we have provincial partners and stakeholders collaborating on their own projects together. So some projects where partners have collaborated are Manitoba and Nova Scotia working together on webinars, and OFA working with the Canadian Mental Health Association and the University of Guelph to set up and deliver in the know mental health training. So on that note, that's kind of a quick overview. Thank you, everybody, and I'll pass it on.
So thanks, Rob. Yeah, it was a fairly exciting time, like Rob said initially, and I'm guilty here. Initially, I thought, oh, this COVID thing is just going to blow over, and we'll be back to regular business by September. And we quickly found out, you know, at first it was just the one little thing, and then then it was, well, how do you transport your employees? How do you get people you pick? How do you pick up or deliver your seed? And it really, you know, I know farmers were used to, well, progressive farmers that take safety to heart already had some plans in place, but usually it's personal safety or it's safety of the animals, etc. But this, or if it's biosecurity, it's how to make sure that the pigs don't get infected. But this was a whole new level of safety and a whole different look, a way of looking at safety, and how do you protect yourself and your workers from I would say non-traditional hazards that normally did not show up on the farm. So I think that's a good segue probably to what Carolyn is doing. So I'd like to introduce Carolyn Sheridan. She's the executive director and the founder of the Ag Health and Safety Alliance, and grew up on a dairy farm in Northwest Iowa and continues to farm there with her husband. Her farming background has been instrumental in her commitment to develop and deliver agricultural occupational and health safety services to all generations for most of her career as a registered nurse. So she has been instrumental in developing a program targeted to college and high school ag students. And I think it's called Gear Up for Ag program. So with that, Carolyn, I'm going to stop sharing and let you take it on.
Well, thank you, Marcel, and welcome everyone to CASA conference again. We, unlike everyone else, I think we're missing a lot of the in-person types of interactions and networking that we get to have today. So Rob and Marcel, I'll leave it up to you to let me know. Are you seeing my screen okay and all of those things?
Yes, we are.
And can you hear me okay, Marcel? I know you said I was.
You have to speak loud because you're far away.
Oh, I don't know. I'm not sure how to fix that. I think this is I've tried a couple of different things, so I will speak loud. I appreciate the opportunity to speak today. I think that many of you on this conference today and on this call right now are people that we worked with, because we obviously didn't know the answers. I think there's a lot of answers that none of us know yet. And so the ability to partner and network, and the things that Rob, you talked about being able to have those meetings, were very instrumental in helping us decide what we were going to do and the messages that we were going to promote on Ag Health and Safety Alliance. Because as Marcel just said, I believe we thought this was going away, and we were looking forward to the fall right now and traveling and delivering our programs. I mean, obviously that's not true. So I will talk a little bit about the things that we've been doing, but also want to acknowledge that we really have relied heavily on all of our partners, not only in the US, but Canada and other nations as well. Also, Rob, if you would give me a nudge, or someone give me a nudge when I have just a couple of minutes left, because I believe 15 minutes, and I want to make sure I'm staying within my time frame. I also want to acknowledge David Sullivan is also on our meeting today, and he was also very helpful and did a lot of the work that you'll see that we were talking about. As Rob mentioned, the shortage for personal protective equipment hit hard. And it hit hard for people who are thinking about, what am I going to do for personal protective equipment? It hit hard for those of us that knew there were a shortage. But people who needed it in agriculture really didn't consider that or think about that at the beginning of our pandemic. But we began to think about it early on. And one thing that I don't have up here within my presentation is the fact that Ag Health and Safety Alliance is fortunate to have a partnership with 3M, and we do have personal protective equipment, particularly respirators, that we provide to our students. And it became very apparent to us when some of our classes became canceled or postponed, eventually canceled, in April, end of March and April, that we really needed to figure out what to do with that personal protective equipment. And it became obvious to us that it was our responsibility to donate that to the medical community who currently did struggle with getting adequate personal protective equipment. So that became one of the big things that we did in March and early April in both countries, United States and Canada. But we also know that farmers still need to have personal protective equipment. A lot of the work that we do, and many of you here on this at this conference do, is protect people by helping them understand how to use not only respirators, but other types of personal protective equipment. We also began to think about, okay, now we're promoting cloth face coverings, and we know that's got some protection against COVID-19. But it's not going to provide protection for our most agricultural tasks. And we became concerned that when this moves on and keeps going on, that we will have people thinking that those cloth face coverings will provide them with some good protection. So we began to think about our messaging, and we pulled back a little bit and said, okay, what's appropriate respiratory protection? What information are we providing? And how do we continue to provide that very important information while there becomes an increasing shortage? And I'm speaking of respirators particularly because we spent a lot of time talking about that. And then how do you pull in this information about hierarchy controls, and how can we have a successful message in this very challenging time? Because this picture you see of me standing in a Momgars, it is in my area. You can see there's lots of respirators available. This definitely is not the case even to this day. And I would rely on those of you that are in the local communities to acknowledge if that's true or not still in your communities. I know in my community and all across the US, this is definitely still a problem. No respirators available. So one of the things that we started out very early in the beginning of March was to think about ways that we could develop some good resources that would allow us to have a good message that says respiratory protection is important. Maybe you can't find it right now. what are we going to do about it? And then as it progressed, we knew unequivocally respiratory protection was not available, although other types of personal protective equipment, such as gloves, particularly, were either shortage for a bit or they became available as we moved through. So up on my screen, you can see, actually it's 3 resources. The first one is 2 pages. These are available on our website. The first one talks about respiratory protection during COVID-19 pandemic. And I can tell you that this was a really, I don't ever like to use the word struggle, but there was a lot that went into this particular resource. We worked with the High Plains Center. We worked with the Central States Center in Nebraska. And then we also had feedback from CDC and NIOSH as we were developing this resource to make sure that we were in line with what the CDC and NIOSH were recommending during the pandemic, which can be complicated. And the second resource that we worked on with the Great Plains Center and the Western Center was how do we continue to push this message that cloth-based coverings are important to reduce the spread of COVID-19. And I would tell you, in many of the rural communities, this is a difficult message. I can tell you that even with a lot of the public health initiatives, lots and lots of information and messaging on television, social media, and in and around local communities, we still, in my area, have a lot of people that don't believe in wearing cloth-based coverings or don't wear them properly. So this second resource we thought was important. And then the third, which was a little bit more interactive, is that we had the opportunity to work with the Upper Midwest Agricultural Center over here. And there's a respirator Q&A toolkit that early in March we put together to try to get good information. So we felt like that these things were successful early, meaning success is relative, meaning we felt successful because we worked and networked with ag centers to get information out there that was very COVID-19 specific, and it is specific to the agricultural population. Back one here. The other thing that became apparent to us because we worked internationally, we were starting to look through like what resources are out there for agriculture about COVID-19. And initially there weren't a lot. And David Sullivan really did a lot of work on this, spent a lot of time researching and reaching out to our international teams and groups that we work with. What's available in Denmark? What's available in Sweden? What's going on in Italy or Serbia or Australia, so that we could really try to have a good mix of information on our website, not just things from the US and what's going on in Canada, not just the basics from CDC. And we felt like we learned from every group that we contacted, like what they were doing, some things that were valuable to them. And that helped us begin to modify or think about how we message, or what do we say on social media as Ag Health and Safety Alliance? What do we do in our online programming? So I think that despite the shortage, I began to hear from people in my community and then across several of the states that we work in, that a lot of our agricultural people had stuff stockpiled, because that's what they do. They buy a bunch and they don't want to go back and buy any more. So we needed to pass on that message. Why do you take care of the stuff that you have? Because we are pretty traditional farmers who may hang a respirator from our rearview mirror. You will find it laying on the floor of a truck. You will see it laying around in the shop. And I began to say, treat that like gold, because you may not get more. So messages we used to say, these respirators down here are the 8511, which you see, that's just which you strap on. That's disposable. You throw it away after 1 or 2 uses. We stopped saying that. So once again, I think we're going to have to back away from some of our messages when COVID-19, when we're on the back end of it. That's the only thing I can say about it right now. We're on the back end of that, which we'd love to say we're not, but we certainly are not. And then also I was a bit surprised by how many people didn't know the other alternatives. Let's say you can't find your 8511s, your traditional respirators. What is a good alternative? Because some of the alternatives continue to be available. So we're also presenting information at an MRASH conference, a Midwest Regional Agricultural Safety and Health Conference, and our abstract really is about this. What are some of the lessons that we're learning? We need to help agriculture prepare for future personal protective equipment shortages. This can and will and perhaps and will happen again. So how can we learn some good lessons? One of them is about networking. One of them is about using each other's resources. We don't develop very many resources without collaboration. So we need to make sure that we have things in storage or take good care of the things we have. Also, some of the things that are out from the CDC are very lengthy and they're very complicated. And so finding a way to have some very short, concise, and I've seen a lot of great resources coming from the group that's on this at CASA right now. And you understand that we need to have things that are less than 2 pages. This little icon says more than, it should say less than 2 pages. And quickly develop things. Boy, this was a fast moving thing at the beginning. For many of us trying to figure out how do we get things developed rapidly so we're ready to deploy them. And then what are we going to do about adapting our programs? We're right in the middle of adapting our programs. I know that all of you are as well. I'm also knowing some people know some alternatives. We also continue. We are partnering with the Great Plains Center. We're pretty excited about some new infographics, which are interactive, that we'd like to have up on our website very soon, and also use them with our students to not just have static types of resources for this group about this topic. This topic is important, will continue to be important. What do we do about PPE shortages? What do we do about storage? What else can we use? I'd like to just highlight some of our recent success. We did deliver our first program in person about 2 weeks ago. Yes, about 2 weeks ago at Iowa State University. We began with an online Zoom training. Students in a great big auditorium, which is a different experience. We're doing a Zoom like this, but then if you're projecting out, and you can see those students. Also wore our masks the entire time. But challenges do revolve. If you can see this picture right here, it's on my right. There's students in the semicircle. We did have our program in a shop, a machine shed. So we could try to maintain that 6 feet plus. It was good we had that because this group of students, we had 4 groups, basically just refused to wear masks. They felt like they were outside, and the college said, if you're outside, you don't have to wear a mask. They considered the machine shed outside. Also, we are very proud of our interactive demonstrations. How do we accomplish those? And we did it successfully. There are ways that you can get students to interact without having you being close to them during the presentation. So I can tell you I have great respect for teachers who spend their entire days with a mask on. You have to talk louder, you have to project, and then when people have masks on, it's difficult to hear them as well. We don't just do Gear Up for Ag programming. We also do restorative fit testing. That's a big thing it's very important right now. And so Ag Health and Safety Alliance was scheduled to do on-site restorative fit training or kind of train the trainer. We were unable to do that. And so did restorative fit test training to certify, and not certify, but to make sure people are trained online. And they had to demonstrate back to me that they could do restorative fit training testing. And you can see from the pictures here that we certainly were able to be engaged. And that, I think that there's a lot of success that can happen in the online Zoom forum, even though I, like many of you, are quite tired of it. So we certainly would like to move past that and get in front of these people again. Also, some of the things that we do is to give prizes and do things such as that. You can still do that online. Send stuff to somebody in the mail. So our one poster that we have together is on our website. It's here. It talks about some of the deployment of resources rapidly. And here's our contact information. I haven't gone over my time, but I really do want to acknowledge that we felt successful some of the time. We didn't feel so successful other parts of the time. And I think that you, many of you probably know that feeling as well. So thank you to all the people here attending the conference, that the support and the guidance that you've given our organization.
Good, thank you, Carolyn. You kind of threw out one question about whether accessing PPEs was an issue. I just did a bit of a poll on the side there, and it seems like quite a few of the provinces have either hubs or are working with their local ag producer group and doing some bulk buying or some accessing through those groups. So just a quick update on what the chat said on the side. So.
And that's great. I think we've seen some success here in the States as well, but then we're starting to see with the rise and that people are starting to see some shortages again.
Okay. So again, to the audience, don't hesitate to put your questions on the side. Like I said, we'll have time at the end of the session to ask them directly to either of the presenters, and if you have something specifically targeted for one presenter, just put that in the chat also. So now I'd like you to introduce Peter Lundqvist. I've known Peter for a couple of years because we met up through the International Society for Agricultural Safety and Health, and took a chance to see if Peter would be able to speak to us, because I don't know, Peter, if you know, but in Canada, Sweden seems to be hitting the news a fair bit, not so much in agriculture, but a little bit on its approach that it took as a country to managing COVID. But I know you've been involved directly with agricultural safety in agriculture, with agriculture, and part of the Nordic conference that happens every second year too. So Peter's main interests are injury prevention, ergonomics, and mental health. He's a professor in work science at the Swedish University of Agricultural Sciences, and is involved with a host of international organizations. If you look at his bio, it's pretty long. He's got, and he's also involved with agricultural science and technology with Korea. So a lot of knowledge in Peter's head, and we've unfortunately only given him 15 minutes to share that with us. So I guess with that, Peter, welcome.
Okay, thank you very much. Okay, I have to try to share the screen, and that's something that not always works out well for me. I don't know why.
Yeah, we can see your screen.
You can see my screen, but so far it's good. But next step, when then it's my tricky thing is to go to the next step. I had problems earlier today here, so I'm making some mistake here, I guess, when I'm.
Peter, you just go. I think Peter, you're perfect where you are. Just go to start slide.
Yeah, but is it too small?
Yeah, you're in the mode where you can edit. So I would just go to where you do present slides now. And
okay, but yeah, but the next time if I put okay, when I press present, it's happening things here. No, then you can't see it, I guess.
Yes,
there we go.
Can.
You don't see it?
No, we do.
No, we do. We do.
You do? Okay, fine. Then I continue. All right, thank you. All right. So I will talk a little bit about the Swedish perspectives. You've heard the rumors, and sometimes I'm sure you have read about Sweden during COVID-19, that we are a little bit different. And yes, about why are we different? Well, we have had, as a country, we have had a little bit different strategy. They never believed in lockdowns. It says that we just say that the strategy had been to slow down the pandemic, not to wipe it out, but to slow it down so that the health system could handle it. And of course, we have initial problems because we didn't have any supplies of PPEs for the people working in the health sector, in nursing homes or home delivering services to the elderly people. We lacked the access to enough PPE. People were not really educated to use PPEs and protect in that sense. We're working with elderly people and so on. So we had a lot of elderly people, especially in the beginning, that died in hospitals, not even reached the hospitals. So we had that was the backside, that we have lots of fatalities, especially in the older generations in the beginning. But then things worked out better, and nowadays they are not more heavily affected than others. And we also have a different system. We don't have a president. We have the prime minister, but he's not really in the power of COVID-19. We have like our constitution says that the ministers of government, they don't have the power to deal with the independent agencies. So our public health agency, they are in charge really. So they decide what is the right strategy to handle COVID-19. And then the government, they are there to give more strength into this guidance, or also to handle the consequences for the society, for the economical things, and kind of changing some minor laws or legislations and things like that. So they are more there to help out, but it's really the public health agency. They are in charge of that in Sweden, and that goes through the whole society, have been from the very beginning. So our strategy have been physical distances. That's have been everything said everywhere, keep the distance and so on. And also it's then there are more advanced regulations in bars, restaurants and events and so on. You can only be on events with maximum of 50 people if you can keep the distance. And you have we're not allowed to visit the nursing homes in the beginning. That's changed. But we never closed schools and the kindergartens, and since schools were open for children up to 16, they have been open all the time. They've never closed down. And those for all over the age of 16, in this spring, they were high schools and universities, they were on distance educations. Now, after this summer, they are back in schools, but the universities, they only have partly teaching education in the campus. They are still on distance. So, and it seems like it's have been a good strategy to have keeping the schools open. And we have never have also and more like enforcements. We have more guidance and recommendations that have been a general recommendation, and the face masks have never been any commitment. We have they never recommended it. They say it's more important that you keep the distance, you wash your hands, stay home if you get ill, and start to work at home if it's possible. So face masks, they say, people, they don't know really to handle face masks. They do all the stuff with face masks. It gives them they don't try. I mean, they feel that they are protected, but when you use face masks, it's often like you touch them, you do things, and they are not. People don't handle them in the right way. They say our health agencies. They say it's better that you keep the distance. And as also there are one experts say that the strategy is to flatten the curve as you had, and it seems to be worked out that we have had that at least in the beginning, in the springtime. It was the strategy, so it worked out quite well in the springtime. But now after the summer, we have very high levels of spreading of the disease of the COVID in the society. So it's quite much around now, but still it's the same type of recommendations, and people go to school and things like that. And we have more, if anyone is interested, there are descriptions of the Swedish strategy, and you can follow everything in Sweden by these links if you like, if you have a special interest. When it comes to agriculture, Swedish farmers, they use the face masks when they work. They don't use it to protect themselves against COVID-19, I would say. And if you go into, there is not much about COVID-19 when it comes to agriculture. We don't have any task forces or any groups working with COVID-19 or anything like that. You have to go to the different organizations' homepages to find information. We don't have any like pamphlets or information material really on COVID-19. They say just follow the general recommendations. That's good for all kinds of professions. Just follow those, and it's good enough. So there's not much special about agriculture. So we are quite different. And that's this from the CEO of the farmers organization says that the agriculture industry, they have done quite well and have during this period up till now, it have worked well, and they have not have any they haven't loosened any money. So the sector have done good business, and they say also that farmers, they are used to dealing with crisis. They have droughts, and they have spreading of the infections and diseases among animals and others. So they can handle different type of struggles. So they say that the general impression is that agriculture in Sweden is still still handling it well. And it's the advice they give to the farmers are you should look after your routines. So be prepared if you get ill and you need somebody else to come and look after your animals and things like that. It should be easy to understand what are your routines. They also have a checklist for risk management, but that's for general type of risk management, not especially for COVID-19. You should also, they are recommended to review your network. So they want people to help out each other in the countryside. If anyone needs help, you should look after each other. You should also see that people are not isolated and things like that. You should look after your insurance policies. There are also questions or answers about humans and animals, and if people have worries about animals in these times, and also about how you can protect yourself. And the guidelines for the farmers, they are about the same as for others, that think about if there is a need to visit your farm. Do you really need to have visitors and try to minimize interaction with people? That's the general thing. And keep the distance, wash your hands and avoid touching the face or eyes and so on. And you have the responsible to reduce the risks. So there is not really much special for agriculture. So I thought that was maybe not the whole truth. So I used Facebook and asked farmers about their opinions, and that was the answers I got from farmers. That the worst thing was the loneliness, that some might lose social contacts, very few contacts. Some of them can be very lonely. I even heard that in Ireland, there were reported suicides from people that felt very depressed about this COVID-19 situation, where they were not allowed to go to meetings or do anything. So that is a problem. Other things reported are hard to find personal protection equipment, also spare parts and things like that. Others report more city people go out in the countryside because they can't go to shopping or parties or whatever. So a lot of people go out in the countryside to walk and so on. And so there can be some conflicts about that. Not many farmers report that they've had illnesses themselves, or not even their workers. Those affected have said that they've solved it quite well because there always have been backup people helping them out when they were sick and so on. Some people had problems with the migrant workers, since we have problems with them traveling in Europe in the beginning of this pandemic, and they also tried to prepare others, to educate others to come and help out, but it was not necessary because people were, the migrant workers were able to come, so there have never been any lack of people to work in agriculture. I'm running out of time. Okay.
Yes, 2 minutes.
Okay. So that's a little bit about COVID-19. It's much, much worse in Denmark. They are now going to kill 13 million minks because it has affected the fur production, the mink production in Denmark. And they even have that the coronavirus have muted and have also infected 12 people in Denmark. So they are very afraid of what can happen here. So they are killing every mink in Denmark. So the whole industries have to close down, at least for a period of time. So it's a really serious situation when it comes to Denmark. Otherwise, we work with other stuff as well. We have serious thing, more and more problems with rural crime. So we have a large study about that. That's animal rights activists and things like that. It causes a lot of stress for farmers. We're looking at that. We have a number of projects on quad bikes. We run full-scale tests with rollover protections on quad bikes. We use the quad bars, flexi, on 50 professional users them for a whole year. We are developing a rollover warning system for when it's going to be too steep and you have risk of having a rollover. It's going to have a reward alarm. And we also have developed a new national strategy on how to prevent and make a safe use of quad bikes. And we're also going to make a large study around for involving all pig industry, and since we think there is a lot of issues to improve in that industry. So, and of course, international collaboration is great. Next week there is a virtual conference in Australia, Farm Safe Australia, and we had one Nordic meeting today in our Nordic languages, but there will be a real one, we hope, next year in Norway. So thank you very much.
Thank you, Peter. Just gonna share screen again here. So just for the audience to know, I guess I will be actually presenting at that Australian conference. I have a small session about giving an overview of Canada, a bit like Peter's overview about Sweden. And just for Peter to know, like Agriculture and Agri-Food Canada is actually set up, I'm trying to remember what they call it, a think tank group. So every week they have some of the top people in each of the departments related to agriculture, and wherever there's a crossover between COVID-19 and agriculture, those people speak to it. And they've talked about, you know, China identifying COVID in some product and wanting to shut the market down. They've talked about, you know, the accessing of the support programs that the federal government has had. They've talked about, you know, the programs to help the processing plants and the workers there. They've talked about the temporary foreign workers. They've talked about the PPE supply. They've even talked about the priorities, determining who gets the vaccine first. about where agriculture fits in there. So a bit of a different way of addressing it than I would say your country is. So very interesting. Thanks for the update, Peter. Just to let people know again, we're going to be breaking out into breakout rooms, and then you're getting rid of me, but then I'm coming back in about 15 to 20 minutes. So as you prepare to go in the breakout rooms, we've asked each host to prepare a 10-minute highlight and then have a discussion with the audience for the remaining 10 minutes. Unfortunately, you are not going to be able to choose which breakout room you're going to end up in. So I hope that's not an issue. But just so that you know, Wendy Bennett will be in one room addressing her insights with the temporary foreign workers. Dean Anderson will be talking about his insights with the greenhouses and the UPICs. And then Lori Brookhouse will also be in her room talking about the PPE supply and resources. So hopefully this all works well. I've got my fingers crossed. I'm going to ask Christine to basically push the button that makes us go into breakout rooms because I don't have that button. Are you able to do that, Christine?
Yes. Okay. Okay. Let's see here. Unassigned. Okay, so let me see here. Can you still hear me?
Yes.
Okay. I'm gonna go to Wendy's and just set her up. Hello, Wendy, can you hear me?
I barely hear you though. Do you hear me?
I do, but I don't think I'm supposed to.
It was supposed to randomly set everybody into a room and it's not what it's doing. So hang on a second.
I actually have the option to join on my screen.
Anybody else have those options?
Join something? I don't see it.
No, not me yet, Christine.
Okay. Well, it did not do what it was supposed to do, and now I'm trying to assign people, and it's not working.
Great.
Don't stress.
I got some sort of an invite. The host is inviting you to a breakout room, and it's telling me to Wendy's group.
That should not be it.
Well, you can hang out with me if you want, Dean.
Well, but all the people who have been listening intently for me won't hear me.
I'm sure that's a very long list as well.
Oh, yeah, it'll be at least 15 people.
Oh, there, Crystal's got the invitation to join.
Okay, it's like I have to randomly assign it. It was supposed to do it itself, and for some reason it has not. So I'm just.
I can join breakout rooms here, it says.
Look out, Lori.
Yeah, mine says I can join in a breakout group, and the only group it gives me is Wendy's.
Okay, just give me a second, okay? I'm just assigning everybody right now, and then hopefully it'll.
Okay.
Yeah. Okay, let's see here. Yeah, I had a bad feeling that this would happen. I don't know why, but I just knew.
To Wendy in this case.
Okay, can you guys hear me right now?
Yep.
Okay, so Wendy,
Yeah.
are you able to share your screen?
I'm
Okay.
hoping yes. Okay. No,
Okay.
can do.
And
Great.
it's recording. Okay, so I'm going to leave this room.
Okay, so we have that. My screen's up?
Yep.
Awesome. You rock, Christine.
Now I just need to leave this room.
In this room?
No, not yet.
Which room is he in, do you know?
Number 2. The
There's a lot of words, but of course, being a resource guide, it was all explanation.
Dean, can you hear me?
Yes, I can.
Okay, which room are you in?
All I see is your name, and it says 5 participants at the bottom.
Because
It says join breakout room, and the only option it gives me is Wendy.
I put you in your own room and I don't know why it's not working. I don't know how to change it. Like it's not letting me assign you anywhere.
I can go out and come back in. I don't know if that would help.
I don't know what else to do. I don't know how to do this.
If I come back in right now, will you then be able to redirect me, or?
I hope so.
I will sign off then.
Yeah, I don't know what to do. I can't hear you.
Can you hear or see me now, Christian? Can you hear or see me now, Christine?
Can you try to put it on your main screen? I can't see the breakout room thing.
Yeah, it's telling me at the top, the host has open breakout rooms, wait to be assigned.
I don't know how to do this. Like, because I don't have my breakout room thing here. I need you to go on your main screen. Like,
Just try and share.
this is just terrible. Like, wow.
Host has disabled the participant screen sharing, so I can't share my screen.
I knew the breakout rooms were going to be the death of me. It's just not working. I don't know how to get you on there. No, Marcel, I need to put just put your PPE
Marcel,
up or
I'm in
something.
the same place where Marcel is. Is Marcel in the breakout room?
No, I don't think so.
You're muted or reading to yourself, Marcel.
I was in the breakout room and I just came back.
Yeah, I don't know how to do this. I don't know how
How
to
do you
put him
get to the
in.
breakout room?
I went in the bottom beside record and I chose yours and I went join.
Where it says record?
Right beside record, there's 4 buttons. It says breakout rooms.
Nope, not on mine.
Okay, so you probably don't have the updated one.
I don't know how to put him in the room. It won't let me.
So can you take people out and just put them in the other rooms?
No, I don't think, I don't know.
The host is inviting you to join. There you go. I've got an invite.
Okay. Oh my word.
There we go.
Yeah, he's only like, he won't have time for his presentation.
There was no countdown to say we were getting kicked
Oh,
out.
sorry, because I saw it on my screen.
It was a really short countdown.
I saw it on my screen.
It was very brief.
So I think we have everybody back here. So if the participants have some questions, just shoot them out, because I think we still have some time.
Wendy, I have a question for you. It's Dan Metcalf from Windsor, Essex in Ontario. We have a big fruit growing and greenhouse operations, owner-operators, and a big temporary farm worker program and SOP program. When you guys started doing inspections or even sending out the survey to the owner-operators, did you get much compliance? I mean, we traditionally have bunkhouses here as well. But, you know, and I know with the new Canadian federal standards probably coming out with, you know, the same agri-sector, is there some time you're giving those owner-operators to change their configuration for housing?
So to be clear, we're the support agency, so we're not mandating the rules. We're just helping to helping the employers to accommodate, to comply with the rules. But I don't believe that they have any time. We had 2 farms last week that had, or 2 weeks ago, I guess, they were doing a test and they had an inspection from 11 different agencies at the same time. And this was a pilot project to try to determine how they're going to do it. So the challenge is there's so many different groups that are insisting on the different things. So I think the expectation is, well, clear here, what I know is that when they submit their LMIA, they also have to schedule their inspection at that time. So they're fully aware of when the inspector will be coming to have a look at how the housing is set up. So the farmers themselves are providing the window of opportunity to make the necessary changes, to the best of my knowledge.
Thanks for that
Does that answer your
information,
question?
Wendy. Yeah, thanks very much. I really appreciate that info.
You're welcome.
Another question? Just unmute and go. I hear crickets. I hear crickets.
Well, I had another question, Marcel. It's Rob here. So Wendy, just kind of continuing the discussion we were starting to have in our leadership panel group yesterday, is the Service Canada checklist consistent across Canada, or does it change from province to province? Sorry, I think you're muted.
I'm talking away. That's a really good question. I would assume, because, and I know that's a terrible word to use, but because it is from Service Canada, my expectation would be that it would be consistent across Canada. And it does state that it doesn't suggest throughout this letter, this 3-page letter, that there isn't or any provincial variations. So it says, if selected, a Service Canada investigator will contact you by phone and by email, and you will have up to 48 hours to provide the required documentation. You have to include arrivals. I can forward this letter, this notice, to whoever. You can put it on your thing. But as soon as the LMIA is submitted, that's when everything starts. So I suspect this is for the entire country.
No, and that's great, because I think that's been one of the problems that we've noticed, is every province has been going at it in a slightly different way, and there seems to be some differences from province to province. So in my opinion, if we can standardize that from coast to coast, that should help with the overall situation.
Yeah, I agree. Well, and one of the things that, and I had nothing to do with it, so I'm not tooting anybody's horn, but the fact that BC chose to administer quarantine, I think made a huge difference and is one of the reasons why we didn't have the incidents that were experienced in some of the areas of Southern Ontario.
I'm just wondering, Peter, would you have anything to add to that? I know you had mentioned quarantine is in your slide. I guess how are your countries managing?
Sorry, you had a question?
Yes, we were talking about quarantining and foreign workers, temporary foreign workers. How has that changed, or how did your countries manage that or work with that?
I mean, we don't really have any EU, the European Union have regulations that we have to follow. But I mean, it's have been up to now, at least they have been open to travel in Europe. And I mean, if you have migrant foreign workers coming to Sweden from Europe, European countries, there have not been any problem. It's from the country where they're coming. It's if they have any regulations of traveling, that have been the problem. Not in Sweden.
Okay. Dean, don't mean to put you on a spot, but did you have any words of wisdom from, I guess, your panel or your discussion?
I don't think I'd ever call them wisdom. I probably have words. I think one of the things that we had, I think it was problematic that in Ontario we quarantined on the farm when the workers came in. I think we did a very good job of getting them through the quarantine period. The problem we had was once they got into the workplaces, it was the blending of the workforce. We did not do a very good job initially in keeping the foreign workers in a separate work group, pod, bubble, however you want to word it, cohort, then the domestic workers. And then the trouble was our foreign workers went back to their confined bunkhouse housing. And so once infection got into a bunkhouse, it tended to spread very rapidly. I think we managed to get it under control relatively well. I didn't look recently to see where our outbreak levels were, but I think they're down to 1 or 2 facilities that still have a couple issues. But once we started to cohort and break the foreign workers into a different working group than domestic workers and kept that separation more regimental in the workplace, I think we had a better job of controlling the outbreak. So the rules didn't change. It was still you were supposed to wear a mask or be spit shield, neck protected, or work at a distance. But once you got into those, a lunch breakout room with domestic workers and foreign workers together, things were allowed to spread. And I think that's where we ended up with probably not being as prepared as we should have been.
Okay, thanks, Dean. I'm just going to pick on Lori now. I know in your breakout session you were talking about PPEs and stuff. Do you have any lessons learned to share with the rest of the group, the ones that weren't in your meeting?
Well, just really being on top of it, because for a period there, we had to check PPE lists out once a week for almost 2 months because it was changing so quickly on the availability from the different resources, and then continuously communicating that to the farm so that they knew where to get their resources and understanding, yes, they had one list last week, but the following week it was a whole new list depending on how to get them, and then preparing them too, knowing that it took 2 to 3 days for the federal government to approve their order, and then another could be 1 to 3 weeks to actually get their order. So our fall harvest went a little bit better because they were able to plan early to know that they were going to get their personal protective equipment a bit later than usual. So yeah, that would be your lessons learned, is quickly getting on top of that.
Okay, good. So I'm just going to do one final call for questions. And I
have a quick question, Marcel.
Sure,
to the group, I guess, just wondering, did any other provinces find that the requirements within a first aid kit changed? In BC, they kind of pushed through some requirements that all industrial first aid kits or workplace first aid kits now must have a set number of masks and a set number of either face shields or glasses, depending on the level of kit you need. I'm just wondering if that happened anywhere else in Canada.
Not in the workplace in Ontario, Trevor. That's controlled in the regulation from WSIB, and that regulation wasn't opened. So regulatorily wise, it didn't change.
In Nova Scotia, our first aid regulations are currently under review, and then we were actually going through that process during the beginning of the lockdown. So there hasn't been any changes on that end either. So we didn't have any regulatory changes for our first aid kits or public health recommending to add anything to them either.
Interesting. BC always seems to be at the forefront, good or bad. So, okay, thanks, Trevor. Well, I think for the sake of time, I'll just thank everybody who participated and thanking all the presenters, Robert, Peter, Carolyn, Wendy, Dean, and Lori. And I guess thanks for Christine in the background to help us make all this work, and for the translator. So really want to thank all of you who participated. Again, we'll have taped these sessions. We'll be putting them up. You can access them through our registration conference link on our website. And we should have a summary page also just highlighting some of the key points in each of the sessions. So with that, I want to thank everybody for your participation. Look forward to seeing some of you, if not all of you, next week. Farmers, I think, usually have been getting their social interaction from going to farm shows, farm fairs, and those have all disappeared. So I think we'll be talking to Adele from Do More Ag, Deb from University of Guelph, and a private consultant, and the last one, Jérôme Gaudreau from l'Association de Prévention des Suicides au Québec. That'll be English presentation, but look forward to hearing them talk about the resources available to farmers and their families in this time. So thank you so much for joining us. Hope to see some of you next week.
Thanks, Marcel.
Thank you, Marcel. Everybody did a great job.
Thanks, Marcel. Thanks, Rob.
Thank you. Nice to see everybody, sort of.